According to the World Health Organization, WHO, more than 30% of all global deaths result from cardiovascular disease, making it the leading cause of death globally. That's almost 18 million deaths a year. The WHO states that most cardiovascular diseases can be prevented by addressing behavioral risk factors such as tobacco use, physical inactivity, harmful use of alcohol, unhealthy diet, and obesity. Diet and exercise can impact two important risk factors, the Omega-3 index and heart rate recovery. Heart rate recovery and the Omega-3 index are important metrics that have been associated with heart disease and decreased risk of cardiovascular disease and all-cause mortality. So what is heart rate recovery? Heart rate recovery is measured by your doctor during an exercise stress test. Once one reaches their maximal heart rate in a treadmill test, they start to cool down, and their heart rate begins to drop. The faster it drops back to normal, the healthier the heart. A rapid heart rate recovery reflects the heart's ability to quickly respond to changes in demand, which is a good thing. Heart rate recovery is measured in beats per minute, and it's calculated by taking the heart rate at maximum exercise, let's say 130 beats per minute, and then measuring it again at 1, 3, and 5 minutes post-exercise. If those beat per minute values drop to 120, then 110, then 90, then the heart rate recovery values would be 10, 20, and 40 respectively. They are reported as positive numbers, even though the heart rate is going down. The Omega-3 index is a measure of Omega-3's EPA and DHA as a percent of total fatty acids in red blood cell membranes. An Omega-3 index in the 8 to 12% range is considered optimal, while an Omega-3 index below 4% puts one in the high-risk range. A recent study looked at the relationship between heart rate recovery and the Omega-3 index in nearly 14,000 healthy adults who visited the Cooper Clinic, where they had a stress test and an Omega-3 index blood test done. The study goal was to gain more understanding of the many mechanisms by which Omega-3s help the heart. In this case, they wanted to see if a higher Omega-3 index was associated with a faster, healthier heart rate recovery. According to the results, individuals who had a faster heart rate recovery had higher Omega-3 index values, and this relationship was stronger in women. They also found individuals with higher Omega-3 index levels had lower resting heart rates, lower body mass index, lower blood pressures, lower triglycerides, higher HDL cholesterol, lower LDL cholesterol, and better heart rate recovery at 1 minute. All of these are favorable for improved cardiovascular health. The association observed in this type of study cannot be interpreted as causal in nature, and someone may say that a faster heart recovery is just a sign of better heart health, and healthier people happen to have higher Omega-3 index levels. However, researchers in separate randomized double-blind placebo-controlled crossover trials, from which you can infer cause and effect, found that when individuals were given placebo or fish oil omega-3s for 2 sequential 4-month periods, the individuals in the fish oil group decreased their resting heart rate and improved their heart rate recovery after exercise. This study shows that having a higher omega-3 index is causing an improved heart rate recovery, and thus is yet another cardioprotective mechanism for omega-3's EPA and DHA. It is also another reason to test your omega-3 index to make sure it's in the optimal 8 to 12% range.